Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to speak about stretching the shoulder, specifically about stretching the posterior aspect of the shoulder, moving the shoulder into internal rotation. Many people have limited internal rotation. Some people call this stretch the sleeper stretch. We're going to do it standing and we're going to do it laying on your side. But some people say this stretches the posterior capsule. Some people say this stretches the muscles. I say it stretches both, to be honest with you. Internal rotation of the shoulder. If we have the shoulder up like this, this motion is called external rotation. This motion is called internal rotation. Again, I'm going to do it with the opposite side so you can see. External rotation and internal rotation. If we have the hand like this, the shoulder is abducted to 90 degrees. We externally rotate the shoulder and then we internally rotate the shoulder. Oftentimes in my office, internal rotation is tested by having the patient put their arm behind their back and see how high that they can reach. Now you think about that, in that motion, there is motion in the scapula moving on the rib cage. That is called the scapulothoracic joint. So there's a lot of motion in that area. There's also motion in the SC joint where the clavicle meets the sternum, called the sternoclavicular joint. And there's also motion in the AC joint where the clavicle articulates with the acromion, which is part of the scapula. It's called the AC joint. But there's also motion right here in the glenohumeral joint. That's what we're going to try to stretch today. It's stretching the glenohumeral joint into internal rotation. Now the glenohumeral joint is where this bone right here, the big bone in the upper arm, is called the humerus, where it meets the scapula. Scapula is the medical terminology for the shoulder blade. The area of the scapula that the humerus articulates with is called the glenoid cavity or the glenoid fossa. It's called them both, really, fossa or cavity, but just remember glenoid. So the joint is the glenohumeral joint. That is where the upper arm articulates with the shoulder blade. So we are going to stretch that area. When you are stretching, you always want to move very slowly. Every stretch should be a mild, comfortable stretch. Never overstretch. If you feel pain or symptoms of numbness, tingling, or burning, you want to lessen the stretch. Some people may not be able to do this stretch. Okay, I'm going to give you a disclaimer. This is a disclaimer. Please check with your doctor before performing this stretch. If you have had an injury to your shoulder, do not perform this stretch on your own. Ask a medical professional before you perform this stretch. Please do not try to self-diagnose yourself. Do not try to do this stretch if you have limited motion. The purpose of stretching is to decrease muscle tension and to increase joint motion in that muscle, to allow that muscle to lengthen so there is increased flexibility in the muscle. So the muscle elongates better. That's why we stretch. Again, hold a mild, comfortable stretch. I will say that multiple times throughout this video, but I want you to understand, please hold a mild, comfortable stretch. You're probably going to get tired of hearing me say this, but I will beat this into your brain so you understand. Hold a mild, comfortable stretch. You should never overstretch. We are not doing this to become contortionists. We are not doing this to try to become some type of performer. We are doing this stretch right now so that you can decrease muscle tension and increase flexibility in the shoulder. I'm going to demonstrate the sleeper stretch in two different body positions. One, as you can see, I am laying on my side, and then the next one we're going to do standing. Again, you want to work very, very gently when you are doing this stretch. but you're laying on your side, you should always have a pillow. We want to make sure that the pillow keeps our neck in line with the spine. We don't want the pillow too high. We don't want the pillow too low. So find a pillow that is a very good height for you. You want to bring the shoulder so that it is 90 degrees from the body. The shoulder is going to be internally rotated so that it is in a neutral position. Remember, out here, this is external rotation, this is the neutral position, and we're going to be stretching into internal rotation. Now, a very important thing that we need to do when we do this stretch is you need to retract the working scapula. That means that this left arm, which is the one we're stretching, is the working arm. So the scapula of this side needs to be retracted. Retraction of the scapula is when the scapula is pulled towards the shoulder blade. And that eliminates the use of the scapula in the scapulothoracic joint in this motion, because we want the motion to be, the stretch to be in the glenohumeral joint. So retract the scapula, use the opposite hand, place it on the back of the forearm, and very, very gently push the shoulder into internal rotation. Very gently, very mild pressure. We are not trying to overstretch. Again, I want to stress this point, to hold a mild, comfortable stretch. Hold a mild, comfortable stretch anywhere from 5 seconds to 120 seconds, and then release and go back to the starting position, and then repeat. So I'm going to explain again. You are laying with a good pillow so that the neck is in line with the spine. We don't want the head to be turned. We don't want the neck to be flexed backwards or forwards, or to be bent upwards or downwards. So keep the neck in a neutral position. The arm is out from the body at 90 degrees. The elbow is flexed to 90 degrees, and the shoulder is in neutral, meaning that it is not externally rotated and it is not internally rotated. You want to retract the scapula of the working arm. Take the opposite hand and very, very gently move the shoulder into internal rotation. Once you feel a mild, comfortable stretch, hold that stretch for 5 to 120 seconds. You should never feel pain. You should never feel any symptoms of burning, numbness, or tingling. If you do, ease off on the stretch. Stretching the shoulder is very important for all athletes, especially overhead throwing athletes or athletes who have suffered an injury. Now, like I stated before, you want to make sure that you check with your doctor before you start doing this exercise. Now, one thing that I failed to mention that I wanted to go over is when you are doing the stretch, you want to keep the elbow flexed to 90 degrees. You don't want to bring the arm in and have it stretching towards the body. So the elbow is flexed to 90 degrees, scapula is retracted, and a very gentle pressure is placed on the forearm to move the shoulder into internal rotation. The sleeper stretch, where we're stretching the shoulder into internal rotation, can also be performed in a standing position. You want to do this one up against the wall. I like to do the sleeper stretch standing better than I like to do it side-lying, but it is effective when you're doing it sideline. Some people like to do that better, so I wanted to demonstrate them both. But what you want to do is you want to be standing in good posture. You are up against the wall. The shoulder you're going to be stretching, I call it the working shoulder. In this case, it's the right shoulder. It's up against the wall. You're going to flex your shoulder to 90 degrees, so your upper arm is parallel to the floor. You will not be in external rotation and will be stretching into internal rotation. So you want to start at a neutral position. The elbow is flexed to 90 degrees. We want to maintain that 90 degrees of flexion. You do not want to bring the bring the elbow into a greater amount of flexion or a less amount of flexion. It just works nice and easy if you have it flexed at 90 degrees. And you are going, again, just like we do when you were laying face down, is retract the working scapula. So you pull the inferior angle, which is the inner lower border of the scapula, towards the spine. So you're doing retraction of the working scapula, And you're going to take the opposite hand and very gently move the shoulder into internal rotation. Again, once you feel a mild, comfortable stretch, hold that stretch anywhere from 5 seconds to 120 seconds. If you start to feel pain, numbness, burning, or tingling, then go ahead and lessen the stretch. But you want to make sure that you have that scapula retracted, and you want to make sure you keep the elbow at 90 degrees of flexion, and make sure that the upper arm is up against the wall and parallel to the floor, because this is going to stretch the muscles at the glenohumeral joint. And then very gently move the shoulder into internal rotation and hold a stretch from 5 to 120 seconds, whatever amount of time works best for you. Thank you for viewing today's episode of Dr. Ozello Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can connect with me on other social media platforms. If you enjoyed this video, please give me a thumbs up. Also, feel free to leave questions, suggestions, or feedback in the comment section. You can subscribe to my YouTube page, Dr. Donald A. Ozello, DC, where you will see all of my videos. I have videos that are being published twice a week. This show, Dr. Ozello Sports Medicine Report, and my other show, 2 Minutes of Anatomy, plus all of my older videos. Please feel free to subscribe to my YouTube page. Thank you for viewing today's episode, and always remember, train hard, train smart, utilize nutritional strategies that work for you, stay injury-free, and accomplish your goals.